Thank you for taking my question. Families say access to loved ones in long-term care is still severely restricted and inconsistent from facility to facility. So when in BC's Restart Plan will care homes become more accessible?
Yeah, so as we've talked about a few times, we are on a different trajectory for access and support for long-term care homes. And partly that was because of the early immunization we did in care homes. And as you know, we increased access and visitation in March. At the same time, we were putting in more restrictions in many other parts of our communities. And yes, we have heard that it is an issue not so much with what we have in place, but the fact that there's inconsistency in how the guidelines are being applied. So we have been working with health authorities to ensure that people do at least get the minimum from the guidelines that are in place. We're not yet at a place where we have sufficient protection in our communities to expand from there. But we will be, and we will be in the coming months as we move into later in the summer, and we're working on that even as we speak.
Michelle, do you have a follow-up?
Yes, I do. So one of the complaints I keep hearing from families is that, so the family member is double vaccinated, the senior is double vaccinated, and yet there are still these severe restrictions. When you've got both people vaccinated, is it fair to keep them away from each other? Like, is there a reason for that?
Yeah, so it is unfortunately the nature that we have seen in care homes, where it is not just me and my loved one that is at issue. It is the fact that if we introduce it inadvertently into a care home, even when we have high levels of immunization, it can spread so easily. So yes, we are allowing for families to spend more time with their loved one, to be able to have that all-important physical contact when you're in that room with your loved one. And those are things that are important right now. And yes, as transmission goes down in our communities and as more people are protected and the risk of the virus being around goes down, we'll be able to expand that as well.